We begin with an overview. We kind of want to set the stage a little bit. And for that overview, we go to Clinton Baker. Clinton, all yours.
All right. Well, thank you, everybody. I didn't hear a lot of clapping for my Go Cowboys. Thank you. I saw somebody else with an OSU shirt this morning. I grew up in Topeka, so I'm both a KU and K-State fan also. Just out of curiosity, how many people in the room are what you would call yourself an HR director or an HR administrator? How many people in the room? All right, about half. All right, so I'm the only CPA up here, so that was half, okay? Approximately. Give or take 30%. How many people are business owners? Okay, about another half. How many people would define themselves as consultants? Another half. Good. We made the math work. That's excellent. Well, as many of you know, the health care reform was originally passed back in December, and then the Reconciliation Act occurred in March. And there's been a lot of talk and a lot of confusion over the bills because they were very different. So in December, the House's bill contained a lot of provisions that wound up and didn't make it into the final bill. And so it was interesting as we've been doing a lot of research and a lot of discussions with clients, we get a lot of questions about, well, is it this percent or is it that percent or is it this number? And I've even had people come to me and say, well, look, right here, I saw it in this article that it's X. And you have to sit back and you have to remember, well, that may not have necessarily been the final bill that was passed. So that's one of the things that we hope to do today is to provide education to everyone, and as we've learned a lot too, and remove some of the misconceptions and some of the differences there. The bill in total over the next 10 years is expected to cost about $940 billion. And so in your slides, you're going to notice all those zeros and 3 commas. So that's a lot of numbers. I read an article the other day. Social Security recently celebrated its 45th birthday. And it was interesting, the first person enrolled for Social Security was, I think, former President Harry Truman. It was kind of an honorary thing. He was no longer president. And at the time, the Office of Management and Budgeting for the government estimated that Social Security would cost somewhere around $13 billion in the year 1990. They were looking 25 years out into the future. And instead of it costing $13 billion, in 1990 it actually cost almost $98 billion. They only blew it by 8 times. I mean, I don't know about your budget, but I don't think my budget could handle an 8-time mistake there. So healthcare is a little scary because when you think about $940 billion, what's 8 times 940 billion? Somewhere around 700 and some odd, or 7 trillion. Almost carried an extra zero there.
Works for me.
Works for you? Okay. Well, if you could, I'd like for everybody to stand up in the room. Let's stand. So what this really does is it allows you the opportunity to adjust your chair because you've sat down and you don't like the view that you have, so you can adjust your chair. But also, if this room represents the United States, prior to healthcare reform, 1 out of every 7 or 1 out of every 6 Americans did not have health insurance. And so, other than this column right here in the middle, I'm asking everybody else to sit down. Okay? So this is the group, you're the group that this healthcare reform was aimed at. Of this group, roughly 2/3 of this group is now going to have access to healthcare. So we'll have the front third, or the front 2/3. Go ahead and sit down. So we're not trying to point you guys out back in the back, but what we are doing, you can go ahead and sit down also. What we are doing is we're making the point that when you talk about healthcare reform, we don't have national healthcare. We don't have socialized healthcare like some countries in Europe do, such as up in Canada, where it's a one-payer system. What we really have is we have healthcare reform. And so when you hear people talk and you hear people read, don't be confused that everyone in the country is now covered with healthcare, because they're not. There is still somewhere between 20 and 25 million Americans that still don't have healthcare. And on top of that, there's probably another 4 million that won't have it but could have it. And we're going to talk about that a little bit later when we start to talk about how does the government try and incentivize them to get health care. So really big picture, it's a $940 billion bill. About half of that is expecting to be paid for with taxes, and the other half is expecting to be paid for with cost reductions. And again, the purpose is to cover that 1/5, 1/6 that didn't have health insurance, and of that group, about a third of them still don't have it. So on a very high level, covering a 2,000 some odd page bill, there it is in 3 minutes.